Welcome to Module 2.3. In this module, we will talk about the different tools and tests used in the algorithm set by European Working Group on Sarcopenia in older people. Learning objectives of Module 2.3. Be able to perform the test and interpret the outcomes. Be able to diagnose sarcopenia in a clinical setting. Be able to determine the severity of sarcopenia. Different tools can be used to diagnose sarcopenia. Tool selection depends upon the patient and his mobility, access to technical resources in the healthcare test setting, or the purpose of the test, progression monitoring, or monitoring rehabilitation and recovery. During the patient history, the patient can report signs and symptoms of sarcopenia, such as falling, feeling weak, slow walking speed, difficulty rising from a chair, or weight loss, muscle wasting. If any of these occur, further testing for sarcopenia is required. The EWG SOP2 recommends to use the SARC-F questionnaire as a way to elicit self-reports from patients on signs that are characteristic for sarcopenia. The SARC-F is a 5-item questionnaire that is self-reported by patients as a screen for sarcopenia risk. Responses are based on patients' perception of his or her limitations in strength, walking ability, rising from a chair, stair climbing, and experiences with falls. The SARC-F has low to moderate sensitivity and a very high specificity to predict low muscle strength. Because of this, it will detect mostly severe cases. It is also a very inexpensive and convenient method to assess the risk of sarcopenia. Here you can see the questionnaire. Component 1. Strength. How much difficulty do you have in lifting and carrying 10 pounds? Component 2. Assistance in walking. How much difficulty do you have walking across a room? Component 3. Rise from a chair. How much difficulty do you have transferring from a bed to chair? Component 4. Climb stairs. How much difficulty do you have climbing a flight of 10 stairs? Component 5. Falls. How many times have you fallen in the past year? Muscle strength can be assessed by measuring grip strength. Low grip strength is a good predictor for poor functional outcomes. Accurate measurement of the grip strength requires use of calibrated handheld dynamometer. When measurement of grip is not possible due to hand disability, isometric torque methods can be used to measure lower limb strength. Now, we will show you this movie on how to use dynamometer correctly.
Sarcopenia is defined as low levels of muscle strength, muscle quality or quantity, and physical performance. In order to assess whether your patient has sarcopenia, you must measure his or her muscle strength. An accurate measurement of the strength can be collected by using a calibrated handheld dynamometer. The outcome of the grip strength correlates moderately with strength in the rest of the body. It's easy to use and simple tool, therefore it can be used in a hospital, clinical setting, or community healthcare. Here we have the JAMR dynamometer. It is validated and used worldwide, while other brands are still being tested. When measuring the grip strength of your patient, make sure a couple of things are in order. Inform the patient about the tool and its purpose. Explain the procedure to the patient. Ask him or her to take off their shoes and jewelry if they maybe have on that hand. Then ask them to sit up straight with their feet on the ground. Start with the dominant hand. Ask them to bend the elbow to 90 degrees. His or her arm should be rotated so that the thumb is the highest point of the hand while wrist is slightly extended. Always use the wrist strap to ensure that the dynamometer won't fall or hurt the patient. Make sure the handle is correctly positioned. This depends on the size of the hand and can be adjusted to the patient accordingly. More precisely, look at the distance between the forefingers and the palm. If the fingernails are digging into the palm, the handle needs to be moved further away. If it looks as if the fingers are too close, or patient says that he or she feels as it could easily slip while squeezing, you should move the handle closer. In addition, you could also look at the middle phalanx of the middle finger, which should be in the 90 degrees with the palm. The other hand should be rested on the patient's leg. After completing the test, while the patient relaxes, you should collect the measurements. The outer dial shows the results in kilograms, while the inner one presents them in pounds. The silver needle or so-called peak hold needle, automatically records the highest reading unit. After this, you can reset the meter and repeat the test 2 more times on the dominant side. Then switch and perform tests 3 times on non-dominant side. After this, you should take the highest value and compare them to the cutoff points set by European Working Group on Sarcopenia in older people. As seen, everything below 27 kilograms for men and 16 kilograms for women indicates probable sarcopenia. Okay, now we can move on to the testing. This is Annie, and he will be my patient today. Can you please sit a little bit in front so that you're not leaning? Okay, bring your arm into 90 degrees. Good, and the thumb should be pointed upwards. Now I'm gonna ask you to squeeze the hardest you can in 2 seconds, okay? Ready? 3, 2, 1. Go, 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 go. Really good. Thank you for watching.
In addition, the chair stand test can be used as a proxy for strength of the leg muscles. The chair stand test measures the amount of time needed for a patient to rise 5 times from a seated position without using his or her arms. The test counts how many times a patient can rise and sit in the chair over a 30-second interval. Muscle quantity. Muscle quantity can be reported either as a total body skeletal mass, as appendicular skeletal muscle mass, or as a muscle cross-sectional area of specific muscle group or body locations. Magnetic resonance imaging, or MRI, and computed tomography, or CT, are considered to be gold standards for non-invasive assessment of muscle quantity or mass. However, these tools are not commonly used in clinical practice due to expensive equipment, lack of portability, and the requirement for only highly trained people to use it. The dual energy X-ray absorptiometry, or DXA, is a more widely available instrument to determine muscle quality, and it is not invasive. However, different brands do not give consistent results. DXA is favored by some clinicians and researchers for measuring muscle mass. The advantage of DXA is that it can provide reproducible results when using the same instrument and cutoff points in a few minutes. A disadvantage is that the instrument is not portable yet. In addition, DXA measurements can be influenced by the hydration status of the patient. A tool which you will commonly see in your practice or in the gyms is the Bioelectrical Independence Analysis, or BIA, for estimating the appendicular skeletal muscle mass. You can see the BIA on the right. The BIA does not measure muscle mass directly, but instead derives an estimate of muscle mass based on the whole body electrical conductivity. The BIA tool is affordable, widely available, and portable. When no tool to diagnose muscle mass is available, calf circumference can be used to predict performance and survival in older people. Physical performance. Physical performance can be variously measured by gait speed, the short physical performance battery, or SPPB, and the timed up and go test, TUG. Gait speed is a quick, safe, and reliable test for sarcopenia, and it's also easy to use in clinical practice. Gait speed can predict adverse outcomes related to sarcopenia, such as disability, cognitive impairment, need for institutionalization, falls, and mortality. The gait speed test is called 4-meter usual walking speed test. The patient has to walk 4 meters while the time is recorded. The EWG SOP2 advises a cutoff speed of less than 0.8 meter per second as an indicator for severe sarcopenia. Timed up and go test evaluates physical function. The patient is asked to rise from a standard chair, walk to a marker 3 meters away, turn around, walk back, and sit down again. Finally, the short physical performance battery is a combined test that includes gait speed, a balance test, and the chair stand test. The following video shows how to execute the SPPB.
Short Physical Performance Battery, or SPPB. It consists of assessment of gait speed, balance test, and the chair stand test. First, we will begin with repeated chair stand. Alright, here I have Morena, she will be my patient. Morena, I want you to bring your arms in a cross position, and I want you to stand up and sit 5 times as quickly as you can. I'm gonna measure this and record it later. Are you ready?
Yes.
1, 2, 3. Start. 1, 2, 3, 4, and 5. Good. Stop the clock once the patient is standing. We will now look at the standing balance. We want to know if the patient can stand unsupported for 10 seconds in a certain position.
As seen in the picture, in the position 1, patient stands with his feet together. In the position 2, or semi-tandem, one foot is halfway in front of the other, but still close together. In the position 3, or full tandem position, one foot is in front of the other with the heel of the front foot touching the toe of the back foot.
Patient may use his arms, bend his knees, or move his body to maintain the balance. But it's important not to move his feet. Okay, so now we have Morena here to perform the test. Can you please stand in the position 1? Okay, can you please stand in the position 2? All right, and let's do the position 3. Very good. That's it.
Hello, and welcome to the third test of the short physical performance battery. The third test is a walking test where we will measure the gait speed. For this test, you need a measurement tape, a white tape, and 2 cones. You first place the white tape on the ground. This will be your starting point. You also put a cone on the starting point, so when the cone moves, you know where it stands. Then you measure exactly 4 meters till the end, where you put another white tape on the floor and another cone on the white tape. Now we're going to perform this test on Hannah. Hannah will be my patient for today. When you're walking with your patient, make sure you always stand close to your patient in case he or she falls. You can also put a chair at the beginning or at the end of the walkway in case the patients feel tired. Good. We will start now. We start in standing from the cone and we're just going to walk. I will tell the patient to walk as fast as possible, but still safely. In 3, 2, 1. And stop. A normal gait speed should be 3.2 seconds for 4 meters. Well done.
As seen in the picture, each part of the short physical performance battery weighs 4 points. The overall grade can range from a 0 to a maximum of 12 points. In the balance test, position 1 and 2 each weighed 1 point, while position 3 or full tandem stand weighs 2 points. If the patient is able to perform the whole test, 4 points may be given. When it comes to gait speed test, the score depends on the time needed to finish the test. Less than 4.82 seconds needed to complete the test will give patient a maximum of 4 points. If he/she needs 4.82 to 6.2 seconds to end the test, 3 points may be given. If he/she needs 6.21 to 8.7 seconds, 2 points are given, and when patient completes the test in more than 8.7 seconds, only 1 point is given. However, patients who are unable to perform the test won't be given any points. The chair stand test is graded in a similar manner as the gait speed test. If the patient ends the test in under 11.19 seconds, he or she will get 4 points. If the test is completed within 11.2 to 13.69 seconds, he/she will get a score of 3 points. When the test is done in 13.7 to 16.69 seconds, patient will get 2 points, and if it's completed in over 16.7 seconds, only 1 point may be given. However, if the patient needs more than 60 seconds, he won't get any points.
Thanks for watching our video about the short physical performance battery test. We hope you enjoyed it.
This table shows the normal cutoff points for each test. The maximum score is 12 points, and the score of less than 8 points indicates poor physical performance. This was the end of Module 2. You can now test your knowledge by taking the quiz of the Module 2.